Hello folks, here we are in the ACA Hematology department. Yay! Alright, I'm getting us started. I'm going to demonstrate a couple of techniques for you today. The first one that I'm going to do is the ESR, or the erythrocyte sed rate. But before I show you that, I'm going to talk to you about a little bit about the equipment that I'm using here. Hi guys. So what you have here is a mixer. It's a rotator that's going to gently mix. You see how it's going very gently. It's not vortexing it or shaking it really vigorously, because what would that do? It would lyse our fragile crystal orbs that are the red blood cells. So it's gently mixing our blood. We also want to have our blood at room temperature generally before we do any of these procedures. So the blood has been on the mixers for a few minutes. All right. So what I'm going to do and show you about right now is I'm going to show you the sed rate, how we're going to set up an erythrocyte sed rate. Okay, so what we're using here is that we're using a product. It's the Fisher brand Dispet, and it has saline in the tubes, okay? This is the Westagrin. Let's rotate it here. The Westagrin erythrocyte sedimentation system, okay? So this is the Dispet tube, and I need to order some more. Okay, so this is the equipment we're gonna need. This is the little tube, and if you can see, it has a bit of saline in the bottom, okay? Then this is the column. It's plastic, so it's not gonna break for us. And we need a tube of blood, and we also need a transfer pipette, okay? So first thing we're gonna do is we are going to label our tube. We're gonna pull it, I'm gonna get a rack. We're going to label our tube and get ready to go. Here's a little foamy rack that I'm going to put my tube in. So I'm going to choose which one I'm going to use. I think I'm going to use this one. So this one is Jennifer Lopez. Oh my. And we have what's going on here. Now this tube is incorrectly labeled as lavender, so that might be an issue, but we know that the pink top is also an EDTA specimen, which is an appropriate sample to do this test on, okay? So I'm going to label it with the specimen number on this tube. So I'm just going to write the specimen number with a Sharpie. So it's 2275. And I've just labeled it, okay? When you go to do this, you think, oh, well, I'll be doing it and I'll know. But if you have 12 other people who are doing it, then you won't know. Okay, I'm going to take my blood. I'm going to, again, gently invert it and make sure that I don't have this. As you can see, I have blood settling in the bottom. So it's so important to make sure that your blood is adequately mixed. Because if I have red cells that are all clumped on the bottom of my tube, I'm not going to have an accurate ESR result, okay? If I don't well mix the blood, it's going to totally mess up the sample. So now, I'm going to take this, and this is a pop top. A lot of students struggle with it, so I'm going to pop it. See, I just pulled it out. I'm going to put it there. And now I'm going to fill my pipette to approximately 2 mils. See how I'm going to open my tube? Oh, one hand. I should actually have put a gauze on it. I'm going to do it the right way now. I should put a gauze on it because this could lead to aerosols. So I'm going to take that off. I'm going to put it down here. Now, I'm going to go in with my pipette and pull up about 2 mils of blood. Now, I'm going to take my tube and I'm going to go down into it. I don't want to get bubbles. So I'm going to slowly fill it. I don't want to overfill it, because if you overfill it, that won't be good either. And I'm filling it to basically where the funnel starts at the bottom. Okay, now I'm going to throw out my pipette. I'm going to cover it and snap it on. So there it is, but I'm not done yet. You notice how at the top of it, it's kind of pale? That's because there's saline there. So now I'm going to mix it. I do this, nothing happens, but if I flick it, I have that air bubble. Now I'm going to do it again. And I'm going to tap it down. Now I'm going to take my column, and I'm taking the end that doesn't have the blue plug in it. So I'm taking the bottom, and I'm going to put it in the top of this container that has a thin plastic seal. So I'm going to put it in, and I'm going to give it a gentle pressure in my hand, and I've punctured it. So now what I'm going to do is I'm going to gently twist it down into my, sometimes it takes a little bit of, there, a little effort. So now I'm going to gently twist it. And as you see I'm twisting it, the blood is rising in the column. And you want to go up to the 0. You don't want to go past it, and you don't want to go under it. So if you don't have enough blood in the tube, that's when you could have a little bit of a problem. I'm getting close. I'm gently twisting, twisting, and I'm there. I'm right at the 0. And you see I have it labeled. So now I'm going to take this and I'm going to put it into my rack over here. And I'm going to record on my result sheet where in the rack I've put it. So here's my SED rate. I set up another one earlier. Hopefully we'll see some of these cells falling in it. And now, how long do I let that sit for? How long do I let the SED rate go? You're thinking? It's 1 hour. So I want to let the SED rate go for an hour. So that's what I'm going to do. I'm going to set a timer now. All right, it's 11:14. So at 12:14, I'm going to come back and check it and record my results. Meanwhile, what I'm going to do now is I'm going to make some blood films for you. All right. I did a little bit of practice here because the blood that I'm using is old. So fresh blood is the best way to make a blood film. So I've made a couple here, and I'm going to show you how I did it. One of them is good, and one of them is not so good. Okay. Which one do you think is good? So we're looking for ideally a thumbprint shape, and as you can see, this one is a fabulous thumbprint shape. This one is cut off here on the side. I didn't let the blood go all the way to the side and it got cut off. So that one's not good. Now you notice I didn't label this one because I wasn't sure which one I was going to use. I want you guys to make a blood film, and when you get a good one, then you label it. Otherwise, you're going to spend so much time labeling, it's not going to be worth it. And I want you to notice that I labeled it with the specimen number, the patient's name, and the date. Okay? These are usually done on the same day the blood is collected. This one, what else was I going to tell you about it? So when we're doing it, we're going to take a nice clean slide. We're going to put a drop of blood onto the slide, and then we're going to pull back with the slide. We hold the spreader slide at a 30-degree angle. 30 degree? I think that's what it is. And then we wait till the blood spreads at the bottom of the slide, and then we move. It's a very quick, fluid motion. A lot of students get very frustrated with it. But you know what? You're not alone, so don't get frustrated. And I like to go and I like to use a stick to get a drop of blood. So as you can see, this is one I used for the last one. Here's my stick. It's the bottom of a swab, a big Q-tip. So now I'm going to take my blood again, but it's been sitting for a minute and I want to make sure I have nice, well-mixed blood. So I'm going to put it back on the mixer, give it a few rotations. I'm going to take the other blood that's been sitting here rotating for a few minutes. I'm going to take this one. And I'm going to use this one to make my slide. So I'm going to put a cover over the lid. I'm going to pop the top. And I'm going to take this and put it somewhere. Now, I'm going to put my stick in. I'm going to mix it around, get it wet. And then I'm going to put a drop on my slide. That's too small. I need more blood. A little bit more. That's good. Okay, now I'm going to take my spreader slide. I'm going to see how I'm holding it here. I'm going at an angle. I'm coming back and moving. And this is what my blood film looks like. Not bad. It's looks sort of like a thumbprint. So I could label that one. I'm going to make another one. I'm going to do one more demo for you here. So here's my blood. I'm going to put a nice drop on it. Need a little bit more. If your drop's too big, you're going to have issues, and if your drop's too small, you're going to have issues. There. I'm going to take this slide. I'm going to go back. See how my angle is? I'm coming back into the drop. And it's a fluid motion. There's the this one. This one is acting a little funny down here, but I think it's okay. I think it's because it's old blood. And again, it's a little short on this side. But what happens with this is when they air dry, we're going to stain them, and the technologist is going to look at them on the microscope and look at the cell components of it. All right, and when you get a good slide, that's when you're going to label it. I'm going to throw out my mass here. I'm going to recap my blood, put it back on the mixer. And I should label that, but I'm going to actually throw it out because we're not going to use it. Okay, the other procedure that we're going to do for our SED rate, for our hematology, is the microhematocrits, okay? We do these two ways in our lab, and what we're going to do today is doing a microhematocrit from an EDTA blood. So these are my supplies. I have clay here. It's like hard plasticine shoved into one of these containers. And you see it has little numbers on it. I'll show you why in a moment. Okay. We have microhematocrit capillary tubes. These are small glass tubes that are very fragile. They're made of soda lime glass and they will break. These ones have no additive to it. I also have other ones that have heparin added to them. These ones have a red color of paint on the end of them. As you can see here, they have a red backing on it to show us that they are the ones who have the heparin. So I'm taking 2 capillary tubes. These ones are blue because they have nothing in them, no additive. They don't need an additive because I'm already using a tube of blood with anticoagulant, okay? If I was doing it from a finger poke, the patient's going to bleed and their blood's going to clot, so I need to use the heparin to do that. That's why we have those to do capillary collections. Okay. So what we're going to do is I'm going to take my blood here. This is on Po short. Okay. I'm going to make sure it's well mixed. It looks good. I have my capillary tubes out. Now I'm going to pop my top again. And I'm going to take my capillary tube. And now I'm going to hold it in, and it's going to draw. When I put it in like that, nothing happens. I might get a little bit. But if I tip my container, the blood's going to flow into it up a straw. So, as you can see, I have a nice full tube. Now, I'm going to wiggle it a little bit. You see here on the end, I'm wiggling it, and I have a little bit, I'm creating a little space here. With the dirty end, I'm going to put my finger on the end of the dirty end. Okay? And now I'm going to put it into my clay. And I'm going to seal it. So I push firmly, and then I'm going to pull it out, and I'm going to do it a second time. Usually you do this on a firm surface. So you see now I have a nice plug, and I didn't put the dirty end into the clay, because if I did that, I would get blood all through my clay. So I put the clean end into the clay. Now, I might be doing 12 of these, so I'm going to make sure that I put this sample up where I record what number it positions it's in, okay? All right, now I'm going to do my next one. I'm going to try and do this one a little cleaner. I'm going to tip my blood close to the surface. Be careful with this. This can backfire. And I'm going to fill up my tube. They don't have to be perfect, but they should be kind of close. Like if I only had a half of the tube filled, and the other one I had it full. So see, I'm tipping it. If I can tip it like this, and I can tip it like this, and if I go too far, I'm going to spill all my blood. So I'm putting my finger on the dirty end. I'm going to go into the clay. I'm going to plug it. I'm going to plug it a second time, and I'm going to put my sample up at position number 1. Okay? And then I would have that recorded on my worksheet. I'm going to close my blood, put it back onto my rotator. So now one of these tubes looks a little dirty, and I'm going to give it a little wipe, because I'm going to put it into my centrifuge, and I don't want it to contaminate my centrifuge. All right, here's my 2 tubes. One is more full than the other, but that's okay. So here I go. This is my microhematocrit. I'm going to put my tubes into separate carriers. They're in. I make sure that I have the carriers in. These are the carriers that I put the tubes into. You can see there's a little bit of blood and stuff on the bottom. We clean these regularly. So this has already been hit with bleach, but we just can't get in there to get it all out. These are my 2 samples in the carrier. Okay, so now I'm going to put this on here, and I'm going to shut it. I lock it, and I hit run. And it's going to run for about 60 seconds, and it's going to spin and separate out the formed elements of our blood, and it's going to show you what percentage we have between the formed elements and the plasma. It's plasma because we had an anticoagulant, right? So that's what's going on with that. So this spins at about 6,000 RPMs, but usually according to our textbooks, these ones would be spinning at about 10,000 in a verified and validated centrifuge. All right, I'm going to bring the camera over here, and I'm going to focus on what I'm doing here, but I got to get my gloves first. large and small. I guess I'll try wearing large gloves today. Usually, yeah. Let's see. All right. Here comes the camera now. Okay. First of all, I'm just going to show you, there's my blood film, up close and personal. There it is. It's dry now, it's ready to stain. This is my centrifuge here, okay? So when I set it up, I push this over to lock it, and I hit the run button. So now what I'm going to do is I'm going to open it, and it opens up. And now I'm going to go look inside. So here I have my two samples. I'm doing this kind of through the camera. So here. Oh, it's hemolyzed. We're going to do our best. Usually they look a little cleaner than this, but this is old blood. So what we're going to do is we're going to set it here in this groove. Okay? I'm going to push it down. So as you can see, it says read or spin. So I want to read it. So I'm going to push the enter button. So now it's telling me it would like me to move this to where the sealant meets the red blood cell. So I'm going to move it to here. I'm not going to go down here because that's where the sealant meets the air, but where the sealant meets the red cells, and I'm going to push enter. Now it wants me to move it where the red cells meet the plasma. So that's just about here. And I hit enter. Now where the plasma meets the air. So now I'm going to move this up, and it's about here, and I'm going to hit enter. This tube is reading at 43%, but I can't just go with one tube, can I, folks? I have to use two tubes. So now I'm going to pull out my other tube, which looks a little nicer, actually. Looks a little bit nicer. So now I'm going to put this on here. Okay, now next, I hit next, and it wants sealant and red cells, so I'm going to move it. It's taking measurements is what it's doing, guys, taking measurements. I hit enter, then I move it to red cells and plasma, and I hit enter. Now it wants me to go to plasma and air, and I hit enter. 43%. Wow! Yay! So now what I normally do is I would add the two together and divide by 2 to get an average. But I have, if the two are the same, then I have 43% is the result that I would record and ask the technologist to verify. Okay? Let's have a look at our SED rates now. It hasn't been an hour yet, but we could have a look at them and see what we've got going on. Is anybody falling at all? They haven't fallen really at all yet. Again, this is old blood, so I'm not sure if it's going to give us a good result. But when we would read it, if I had something here between the 20 and the 30, that would be 25. But remember, 0's at the top, so you have to count down, right? I don't want you to get confused about how to count on these. So really just use your basic, good basics, and see that if it's above 40 but 50 is on the bottom, it's going to be 38 probably, right? So you got to really think about these markings and where the numbers are. We'll see if these guys fall or not, or how it's going to look, but I'm not sure how it's going to go. Okay, let's do a quick stain of our blood smear now. So this is going to be using Camco Quick reagent. I'm going to discard these guys because these are sharps. These are breakable glass and they're covered with blood, so I want to put them in a sharps container. I wouldn't want anybody to come across that. All right, our Camco quick reagent. Here it is. Here's our container. Here's our labeling. This label needs to be changed because it's expired and it's empty, right? This is as clean as she gets here. So I'm going to actually fill this up to do a little stain. Actually, you know what? I'm not going to fill it up. I don't want to waste it. I'm going to do my stain here on the staining rack. So it's only going to take a few seconds to do it. I'm going to go get my stain from the flammable cupboard. Hope you guys didn't see my footwear. It is highly inappropriate. Okay, here we go. We have, this is highly flammable, toxic if swallowed, and poisonous. This isn't a great one. So you see it has the danger on it, and I'm just checking that this is what I'm going to use. Camco Quick Stain. Okay, here we go. I'm going to bring this over here. I'm going to go get my slide. The procedure, I believe, is, I'm going to look it up before I teach you guys something wrong. Let's see, is it on the bottle? It might be on the bottle. First aid, handling and disposal, no. Yeah, here it is. Prepare blood slide. Dip, slide, and stain for 10 seconds. Dip in distilled water for 20 seconds or more for darker staining, and air dry. So that's what we're going to do. All right, I'm going to get some distilled water. Just make sure I have nice, fresh distilled water. Here's my distilled water, and I'm going to put it into my stain jar that is labeled distilled water. There. So I want you guys to think about where is a good place for me to put my ESR container? Is it good that I have it set up near that little centrifuge? I think you guys should know the answer to that, right? So that would be a no. Okay, so now I'm going to get a little transfer pipette. And here we go. I'm going to open my stain. I can't do that with one hand. Okay. Here we go. All right. Here's my slide. I'm going to go on to it, and I'm going to flood it and let it sit for about 10 seconds. Okay. So 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. Now I'm going to get some forceps here, and I'm going to take it, and I'm going to, there, I'm going to dip the excess stain off, and then I'm going to dip it into my Copeland jar for 10 seconds. So 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. And now I'm going to go in and pull it out. Gotta find it. I'm fishing for it. There it is. It's stained. Now it said 20 seconds, so I'm going to re-dip it. Usually when we do this, we have 2 Copeland jars filled with distilled water. Okay, so, oh, I'm ruining it with my forceps. That's okay. You guys get the point. So you see See, I scratched it with my forceps. I went too far into it, but that's okay. So now I have to let it air dry. So what I'm going to do is I'm just going to lean it up here. And we have a slide rack that we might be able to set up. And we're going to just let that air dry. Okay? So while that's air drying, I want you guys to think about what is in the Camco Quick Stain. You guys just did histocyto. Why didn't I have to fix that, that slide? What is in that slide that's going to allow us to not have to fix it? Do you guys remember? And what kind of a stain is it? Is it H&E? Is it a retic stain? What is it? So that's the other thing. So methanol is the answer. Here it is. So methanol is the answer to what that is. Okay. All right. Look, Nikki, we got our lancets. All right. Here's my microscope. Now I'm gonna pause it for a minute, and I'm gonna wait for this to air dry, and then I'm gonna come on and show you some cells. I think I'm going to pause it.